Thank you, Mr. Vice President, Mr. President. Thank you for your words of discipline and determination. I guess that really describes what we're asking every American, to really be disciplined about these guidelines and really determined to stay in that space of execution. You know, we are just in week 3 of this full guidance measure. We really do appreciate the work of the citizens of California and Washington State, because we do see that their curve is different. Their curve is different from New York, New Jersey, and Connecticut. And we really believe that the work that every citizen is doing in those states is making a difference, and it will make a difference for the frontline healthcare providers. We also are deeply grateful that despite the way their curve looks today, they continue to get ready for a different potential, so that they can ensure that patients, if they do get sick, have options and availability. To all the frontline healthcare workers in what we have referred to as hot zones, areas where the number of cases are quite significant, the New Orleans, the New York City metro area, including New Jersey and Connecticut, the incredible work that the frontline healthcare workers are providing. We're really working now at a much more granular level, talking directly to hospitals to ensure that they have the supplies that they need in coordination with state and local governments. And to work, I think we discussed it yesterday, but I think it was quite clear also and reiterated by Governor Cuomo today, that we have to support one another as each of these different metro areas and other areas move through their peak of new infections. When we talked about it at the beginning of this week, we talked about this week and next week being incredibly difficult. And we want to recognize the number of Americans who have lost their lives to this virus, and recognize the sacrifice that healthcare providers are making both in their care, but I think I'm very uplifted by hearing their messages to families and their compassion for others to provide that kind of support to the individuals in the hospital. We continue to watch, in addition, the Chicago area, the Detroit area, and have some developing concerns around Colorado, the District of Columbia, and Pennsylvania. So as you can see, each of these will follow their own curves. We'll be getting more and more of those case over time information in a very granular way to each and every one of you, so that we can follow these epidemiologic curves as each of these states, counties, and communities move through this together in solidarity, and really ensuring that we can move supplies creatively around the country to meet the needs of both the frontline healthcare providers, but also every American who needs our support right now. Thank you.
Thank you very much.